Well, my friends, this is Mr. Jadab, Sikandar Jadab, has come from Jharkhand, near Bihar. He has been suffering from diabetes mellitus, type 2 diabetes mellitus. Already I have demonstrated about diabetes mellitus in many of my videos. The question is whether any treatment in homeopathy for diabetes mellitus or not. Yes, we have enough scope. When the level becomes very high, like blood pressure increasing, that is hypertension, we may help of some modern medicinal physicians, because homeopathy treats the patient as a whole to eradicate the disease, to minimize the aggravation, to rectify the changes the system. So diabetes, it is a disease composed of a group of metabolic disorders in which various genetic and environmental factors result in progressive loss of beta cells of pancreas. So, dysfunction and failure of beta cells of the pancreas cause failure of functioning of different organs of the body. Eyes, kidneys, peripheral and autonomic nervous systems, heart, blood vessels, and it also increases the risk of cardiovascular and cerebrovascular diseases such as brain, cerebral stroke, cardiac stroke, as well as in some cases there may be cognitive lack of development. So diabetes mellitus, this patient is gradually increasing. The blood sugar level is gradually decreasing and patient is coming into normal position. Some medical conditions can alter HbA1c results, but the BSL level test nowadays can check themselves by finger sticks capillary blood glucose method with a glucometer. The procedure of blood sugar level test by glucose stick method I am describing. Anyone can test the blood sugar level at their home. Before the test, the patient had nothing to eat or drink for at least 8 hours. The instrument for measuring BSL, the blood sugar level, is known as glucometer. A test strip should be inserted into the device. Then with a special needle, the fingertip is pricked and 1 drop of blood is poured at the end of the strip, and then blood glucose level will appear automatically in the screen on the meter. The special needle is known as lancet. Now, if the treatment is not adopted by the patient, there may be various types of complications may arise. Complications of type 2 diabetes mellitus are life-killing complications, hence called a slow process of suicide. It has a lot of complications. Some of the important complications should be known to the patients. Number 1, diabetic ketoacidosis. It is a life-threatening hyperglycemic emergency It has been characterized by hypoglycemia, hypokalemia, pulmonary edema, cerebral edema, acute respiratory distress, etc. Number 2, hypoglycemia. It means acute activation of the autonomic nervous system and those secondary glucose deprivation of the brain. So hypoglycemia also affected mood, inducing a state of increased tension and low energy. It can affect also the heart and cardiovascular system. Diabetes increases the risk of many heart problems, including coronary artery disease with chest pain, etc. There may be diabetic neuropathy. Increasing glucose injures the walls of the tiny blood vessels, especially in the legs, which causes numbness and burning pains of the legs, which usually begins from the tip of the toes or fingers and gradually spread upwards. The kidney may be damaged. Kidney damage is known as diabetic nephropathy. Diabetic nephropathy. Diabetes can damage the delicate structures of the kidneys, and there may be excessive deposition of glucose in the glomeruli of the kidneys, which disturbs to excrete the waste products from the kidneys. It may be damage to the eyes, known as diabetic retinopathy. Diabetes can damage the blood vessels of the eye, which could lead to blindness even. It can also cause the early formation of cataract. It can damage the foot, which is known as foot damage. Diabetic foot syndrome is the ulceration or destruction of deep tissues of the foot, even including the bones of a chronic diabetic patient. So diabetic damage to the nerves, to the kidneys, and equally important to the eye. In case of male, there will be erectile dysfunction. In men, long continuing diabetes mellitus may cause impotency or erectile dysfunctions. There may be gastrointestinal disorders, there may be skin problems, etc. There may be hearing impairment, and there may be also Alzheimer's disease. Diabetes mellitus may increase the risk of dementia, which is called Alzheimer's disease. So be careful about diabetes mellitus, my friends. In homeopathy, we have scope, we treat the patient as a whole, the internal man, by the constitutional mode of homeopathic treatment, and gradually the patient's in the verge of improvement comes. This patient has come from the Jharkhand and he is gradually improved in all respects by our constitutional medicine. Thank you very much.